Hello, everyone. Heather Holmes here with KTV Fox 2 News in the San Francisco Bay Area. And once again, we are joined by Dr. Rashid Chotani. He is one of the leading infectious disease specialists, and we are so happy to have you back again today. I know you are now in New York, and tell us a little bit about what you're doing there.
So first of all, thank you for having me back, and it's a pleasure to see you again. And things, as you know, are not getting better as quickly as possible, as quickly as we like in terms of the disease burden and the deaths, etc. In New York, obviously, this is the epicenter, and I'm in Manhattan right now. And there are a lot of people over here who are concerned about how they can open businesses again. And one of the things that Governor Cuomo also said yesterday was, we've got to do this antibody testing. And once it is done, then we can start understanding what the burden of the disease is in the community. And thus, some folks in New York, some of my friends asked me to come over to Manhattan and see if we can set up some operations over here so they can start screening workers, so workers can go back to work, number one. Number two, if they are still infectious, then they can go and be quarantined. So they're trying to establish a system over here, independent of the government, to be able to do something similar.
So this is an antibody test?
Yes, it is an antibody test. It's a 10-minute serum antibody test, which tells you if you have recent exposure to the disease, or it tells you if you've had a long-term exposure to the disease. And what I believe is that in New York, because the disease has been here for a while, that there'll be a lot of people who will have exposure, long-term exposure to the disease. So essentially, at this particular point, they're not infectious. They will also be IgG positive, which means that they have developed the real antibodies against the disease, and they are the frontline people. So we have to identify those frontline people so we can start our economy back again.
Talk with me about the importance of this testing. How many people in New York, once this is up and running, you hope to test, and what those results will ultimately mean for example, New York City?
So I believe that every business over here would like to get a hold of the test kits and start screening people as soon as possible. The critical thing that I was advising people over here today was that we've got to get the test kits that are the valid test kits. Do it under a clinical setting so that the people that come in to get the test done, they're doing it under a clinical supervision with somebody who's licensed to practice in New York so that they can give them proper advice and the right advice as to what needs to be done. Now, I can assure you that, based on the data that has been collected in New York as well as other places, that a lot of people will have had no exposure to the disease. So those are the people who they're still at risk, but at the same time, they're not infectious. And if they observe precautions, they can go back to work and start the process in a very quick and expedited way, because the test just takes about 10 minutes. And as I told you earlier, Governor Cuomo, based on a study that just came out from New York, where they were looking at the data, it looked like only 20% of the people might have had the infection, but a lot of them might have had immunity developed by this time that they can be frontline people. So those are the people we need to identify and start working on that and do as much testing as possible once it's available. And I believe it will be available in the next few weeks, and get the nation back to work.
Are you concerned? Obviously, the FDA is trying to speed up the process of some of these antibody tests. Are you concerned about how well they are working and if they might actually come back with a lot of false negatives or false positives for that matter?
So FDA is working very hard, and I honestly have total confidence in the work that FDA does. They have always been extremely vigilant about taking a look at the data, testing the data, and then evaluating it. That's why it's taking a little bit longer. Otherwise, if somebody just took the data and said, okay, this looks good, let's move forward, that's not what FDA is trying to do. FDA is trying to evaluate the data, evaluate the test, and then have some validation done on it so that they can be sure that this is the test that is required, or this is the test that is valid to be out in the community. So I believe there's a huge queue right now, a line of manufacturers as well as manufacturers of the kit that have put applications in FDA to FDA, and pretty soon some of them will emerge. Two of them have already emerged as the leaders that have emergency authorization used through FDA to be used. The second phase of that is going to be that manufacturing ramps up so that those kits are made in a facility that is compliant with everything. And once that happens, we should have enough kits. But as I said earlier, and last time I was with you, that once the manufacturers in the United States know, around the world know that this is a test that is going to be used, those things can be done very quickly. For this particular kit, what is needed is one of those 3D machines, and they can pop them out very quickly. And I believe that's going to happen very quickly, very soon.
I want to talk with you about another big development. Earlier this week, we learned that perhaps the first coronavirus death was much earlier than we anticipated, and right here in the Bay Area. Talk a little bit about the significance of that and just what it means.
So we've realized something that actually I've been talking about for many months, that the disease has been here for a pretty decent amount of time, perhaps in December, January timeframe. And thus we had community, acquired disease that was circulating, and people were getting sick. It is going to be difficult for us to go back and evaluate every single case and death that we have labeled as influenza death during that particular period of time. But most of the experts are saying that some of those deaths probably were coronavirus deaths that we labeled as influenza deaths, because this year our influenza death numbers were much higher than previous years. So unfortunately, the disease was here, the disease is here, the disease has caused havoc. But at this particular point, as I've always said, my objective is to find a solution. Yes, there are problems. We can deal with those problems later, but spending too much time on why, what, if, and all those kinds of questions is not going to help the population and the nation get back to work. What we need to do is to find quick solutions, and have the experts come up with the right methodology, right means to identify what the total burden of disease is in the nation, and then we have to then work on mitigation strategies and developing resilient populations that can deal with this problem.
And what do you see some of those mitigation strategies being?
So obviously there are multiple tools in the toolbox that we need. One is that we have to have the capacity to test, whether it's a PCR test, traditional PCR test, or it is the rapid PCR test, or it is the rapid antibody test. So all these three are going to be useful. We've got to use all of them. We cannot wait till we have a perfect solution. Perfect solutions are never going to come. No test is going to be 100% efficient, efficacious, specific, sensitive, whatever term you want to put to it. So we've got to start doing that. We are not going to be perfect. We're going to miss, but we will catch 80% of the problem, or maybe 90% of the problem, or even 95% of the problem. And to be honest about it, I can live with that if we can find out exactly what the burden of disease is, because what that tells me is how much prepared I need to be as we go forward within this epidemic that is going on, how many hospital beds would be required, how many ICU beds would be required, how many intensive care beds would be required. And then it also will help me identify how am I going to do, and you've heard this thing quite a bit on TV now, and this is something that epidemiologists like myself do all the time. It's contact tracing. So for example, if you were positive, if you were positive for coronavirus, then what we've got to do is we've got to find out who you were in contact with, and then go back and back and back to identify anybody who was in contact, and then test them if they were positive and see what we can do. Now, once we've done that, then the next phase is that we've got to have antivirals. We've got to have antibiotics. I'm sorry, not antibiotics, antivirals, vaccines, and one of the things that I'm an advocate for, which is plasmapheresis. And for that, we've just, fortunately, USA Today just published an op-ed that I and a very good friend of mine, Mr. Fisher, wrote, which talks about why is it that we need to have a national registry for immune Americans, so that we can have that data, have that serum, and if need be, wherever the need be in the United States of America, we can then provide that to individuals who are in critical need of it in critical care units, who have no other option right now because there's no medication, as we all know, at this particular point that is useful to treat this disease.
I want to talk with you about some of our counties here are looking to ease some of the restrictions. We have Napa County that is looking to slightly modify its stay-at-home orders. What do you think about that right now? And then also, are you concerned about what we're hearing from officials about a potential second wave of the virus?
So, to be very honest about it, at some point or another, shelter at home has to be, relaxed a little bit. But we've got to be very cautious and careful. You've got to take a look at the data. You've got to take a look at what is happening in the community. We've got to establish this contact tracing, the testing. You've got to set up sentinel surveillance systems within a county, because obviously, we don't have enough resources to do the whole county and test the whole county because of the limitations that we are facing right now. But we can do sentinel surveillance. We can go in certain areas which are demographically, socioeconomically different from each other, and then spread across the county and be able to do some of these testing and then contact tracing. And then we can get a much better picture of what's going on. Then obviously, in California, that I call a country by itself, and each county I call essentially a state, because it's so large and it's so big, and you've got such a huge population. One of the things that I've noticed, and I've looked at it, is that each county is doing a tremendous job in terms of collection of data. Each website that I go to has all the information that's required, all the information that, totally transparent information, which is incredible. And I commend all of you guys for doing that job. One of the things that each county has to make a decision on its own, but I would say that they have to be extremely cautious. They need to talk to experts and epidemiologists to make, to provide them with, information and guidance in this problem, as well as be very flexible. Flexible meaning that you do a phase-in, phase-out type of a policy. So if you open things up, you open them up very slowly, and then you observe very carefully as the administration's plan is for 14 days as to what's going on in your community. Once you realize that the cases are not going up, the testing is coming up negative more than positive, then you look at your hospitals and see if you have the capacity, even if you have less numbers, and then you start opening up slowly. You look at places that you can open up which have less congregation of people, less contact possibility, and then you modify behavior. Social distancing is the number one thing. The second thing is that you can implement engineering barriers. What you can do is you can take a look at how you can provide, like most of the restaurants, while I was driving from DC to New York today, and I stopped at a couple of places, and they have these shields that are up there. And each employee is wearing a mask and wearing gloves, and they're observing infection control practices. And on the floor, you see these markers that say 6 feet apart, keep the distance. We have to do all of those things, unfortunately, as we move into this new life or new world that we live in, and then slowly and steadily start opening up, workplaces and common places and public places.
But are you concerned that it might happen too quickly?
I'm extremely concerned. I think, again, as I said, the data should be the guide because the virus doesn't really care about what we really want to do. And the only way that we can find out what's happening with the virus is if we do serious data analysis, take a look at what's going on in real time, and then make decisions based on that. Now, the second question that you had was about the second wave. And yes, I'm extremely concerned about the second wave. Now, the reason that I'm extremely concerned about it is because the wave is going to come at the same time we have influenza. So 2 respiratory diseases simultaneously we'll have to deal with, which we have dealt with, in my opinion, already in a big way. But what if this virus comes back and it's more virulent? We don't know that as yet, but what if it comes out that way? That is going to cause a serious problem. The other thing is, every year influenza comes back and we vaccinate people, the vaccine is never 100% efficacious. Sometimes average 60% efficacious. So that means that everybody or anybody who gets a vaccine, perhaps 3 to 4 people will still develop the disease. So that is something that we've got to think about. And if hopefully the strain of influenza remains very much exactly the same that it is, then we don't have a problem, because then we have the right strains in the vaccine. But if it shifts rather than drift, then we have a very serious problem. We've got to be ready for everything. We've got to develop resilient communities to be able to face any type of disaster, a natural disaster like this. And for that, the public health departments have to be strengthened. They need to get more people, to be very honest about it, to work over there and do much more in terms of surveillance. And surveillance is what's going to help us over here to be able to make those decisions and to understand what's going on in a community.
All right. Dr. Chotani, always a pleasure. Thank you so much. You stay safe and keep up the great work, and we'll check back in with you next week.
Sounds good, and I look forward to seeing you next week. Bye-bye.
Thank you.